Talk about health and aging because later this month, Innovarx Global Health IGH and Aging with a Smile Initiative, the Gambia ASI, are jointly to launch a campaign designed to generate multiple benefits for IGH, ASI, and for the targeted clientele that is older persons in the Gambia. Well, let's get more information on this from Dr. Ismail Badjie, founder and CEO of Innovarx Global Health. Thanks for coming on the program, Dr. Badjie, and thanks for sponsoring this 15-minute slot.
Good morning to you and good morning to all your listeners.
Fantastic. Why the sudden focus on older persons and why the alliance with Aging with a Smile Initiative, ASI?
Well, Peter, I think there's an urgency of now, especially when it comes to it being just the right thing to do. I think we've realized the time that we've been in the Gambia that we have, as a country, we have opportunities to almost tell older persons, thank you for your service, because I really do believe older persons in the Gambia are a very small percentage of the country from a demographic standpoint, but have contributed significantly to the development of the Gambia. And if you look at where older persons are today, a lot of these individuals are our founding fathers, meaning people that have now been a part of the First Republic, served the Second Republic, some of them even served the Third Republic, are now in a position where I think a great debt is owed. And I think it's always important to give them roses while they could smell them. Some of the listeners may not understand the context. If you look at the Gambian demographic based on 2020, over half of our population is young, meaning haven't even celebrated their 25th year-old birthday. When you look at the older persons, only 4.5% of our citizenry is between 60 and 74 years old. And that percentage becomes even smaller when you consider people who are 75 and older, which is only about 1% of our population. So they're a very small sector of our population. Yet in 2023, you could compare Gambia statistics to places like Japan, where almost 30% of their populations are considered elder persons, but their life expectancy is one of the highest in the world at 85 years old, where the average Gambian doesn't live to be 65 years old. Our life expectancy is 65 years old. So I think a lot of factors, and also picking up, collaborating with Aging with a Smile, led to this opportunity.
Now, as a pharmacist who has worked in the West and who is now working in Africa, what has your experience been regarding the disparities in care for older persons? And do you have any lessons learned?
Yeah, I think that's an excellent question. I think the first thing to mention is a safety net or a lack thereof for older persons. If you look at places like the United States, where they have a fully functioning system that provides access to healthcare for a lot of citizens that are considered seniors, that provides a safety net where at least access to healthcare is readily available, especially a lot of the work that we do in the communities are revolved around removing common barriers to care. For a population that, even if you're the healthiest individual through as you age, by nature of Father Time being undefeated, health becomes something you think about. I think if you juxtapose that to the Gambia, we still have a fight or flight relationship with healthcare for our seniors, and oftentimes the few privileged who may have children who are considered successful in their careers become their safety net, but yet still a lot of people only have a relationship with healthcare in a time of crisis and emergency. So I think that disparity, I think society hasn't matured enough for us to have proper safety nets that's democratic in nature. And that factors a lot into what healthcare is available, the quality of it. That's the biggest difference. And I think lessons learned is just knowing that these individuals are vulnerable as well too, in terms of what they may not have access to. That's the biggest difference. Hopefully we'll get to a point where Gambia can create a safety net for seniors, also as a way of preserving their life and also just giving them a better quality of life as they age gracefully.
Mm-hmm. And in your opinion, Dr. Badjie, given the various challenges of our healthcare system here in the Gambia, tell me in practical terms, what do you believe we should be working towards in terms of the future of healthcare for older persons in the Gambia?
Yeah, so I think we need the seeds of health in our 30s and 40s to prepare our older citizens for our 50s and 60s. There's a saying that African men in particular spend all their lives chasing money and status in society to get old and spend all their money and status in society chasing their health. Because if you look at the common trend, health is normally put on the back burner. So I think we have to transition to a flight or fight relationship with healthcare to a more preventative that starts early. Because most of our citizens who are in their 50s, who are in their 40s right now, should prioritize health. But I think part of the conversation too, Peter, is a lot of individuals, I think they confuse health and wellness. I think when it comes to older persons, health is more objective. Meaning, is your blood pressure high? Is your blood sugar high? Do you have any chronic condition? But oftentimes what's missed in the conversation with seniors is their wellness, which is more subjective. How are they feeling? Are they going through loneliness? The average senior's experience in the Gambia, maybe you live with your grandkids, you lack intimacy, and intimacy not even from a sexual standpoint, but intimacy in conversation, intimacy in touch, because maybe you've been a widow since you were 56. So there's a lot of elements to what I envision where health has to be treated from a subjective and objective standpoint, where we see it as the health and wellness of individuals. And if you consolidate all those concepts, fundamentally it just means making it more democratic and removing all barriers that are present. The typical barriers for older persons might be cost of healthcare, access to transportation. Do they live in the Combas or do they live in Farafenye or Mansa Kongo? So I think being very intentional about identifying what the barriers are, but also treating health and wellness from a holistic standpoint is always what we've envisioned the health system to be.
Most people seem to take it for granted that access to quality healthcare in the Gambia is reserved for the privileged few by virtue of their purchasing power and or proximity to urban centers. But as a healthcare professional and solutions provider, what are your thoughts on this situation?
Yeah, I think there's some truth to that. Gambia, like many African countries, our health system is fragmented. And what that means is for you to have one healthcare solution, oftentimes you have to go to 3-4 places to get a healthcare solution. That could be a trip to a doctor who's at another facility, who sends you to a lab, going back to the doctor. The doctor then sends you to a local pharmacy just for you to get one solution, right? And on average, even in modern systems like the USA, there's a saying that almost 40% of the prescriptions that physicians write never get filled by the patient. So you could only imagine what the fragmented nature of our health system does. But oftentimes, as you mentioned too, there's always been, a case of the haves and the have-nots. Our public systems are overburdened, typically with limited resources. So it tends to create a bandage approach to healthcare, where they may not treat the condition long-term in a continuous way, but they maybe fix the problem short-term, but not have systems in place to continuously manage the care. And that's what I think there's disparities, not only in private sector, public sector, but the lack of technology in our health systems where medical records are not continuous. So most of our older persons always have to restart their health journey, because if you go to clinic X, they need to move you somewhere else. You go there, you restart the whole process. So you're accumulating costs because we're such a fragmented health system. So even if you can't afford private care, quite frankly, our outcomes sometimes could be challenged, which is why as a country we lose significant amount of money to places like Senegal that tends to be people's next resort. And normally a trip to Senegal actually doesn't mean good health outcomes, which is also something very, a misconception that we have. But I think the fragmented nature for sure contributes significantly to a lot of the challenges. And the rural communities we spend a lot of time in the rural communities in the Gambia, and we see how vulnerable they are. The older persons there, literally, if your closest hospital is a couple of hours away, what's the likelihood of somebody being able to check their blood pressure to make sure that they're healthy? What's the likelihood for them to check their blood sugar to make sure diabetes is not bringing them closer to mortality? So just a plethora of issues that not one person could provide the solutions, but starting the conversation creates an environment where we could put practical solutions in place.
Finally, Dr. Badjie, what is the Innovarx story, the Innovarx model when it comes to the care of elder persons?
No, thank you, Peter. I think most people that have interacted with Innovarx know that my why for the company has always revolved around my grandmother, Adja Menga of Afdai Banjul, who died when she was 56 years old from diabetes and hypertension. You could arguably say that she was very significant in terms of women leaders in Banjul, but she's not unique. She died at 56, where, going back to what I mentioned, where Japanese are living to be 85, people dying early, they say if elders die early, it's as if a whole library gets burned down. So somebody dying at 56 robs Gambians of so much human experiences because they don't get to know their grandkids. They don't get to know their great-grandkids, which is an unusual phenomenon in the Gambia. But in most parts of the world, people get to know their great-grandkids, right? So we've always seen that, okay, how do we create an environment or a company that provides opportunities for a lot of Adja Fatim Bengas to live to be considered a senior citizen, make it to 65. Even if you look at the current trends in Africa, only 1 out of 3 men in Africa live to celebrate their 65th birthday. So I think that's always revolved around, okay, personally, how our grandparents, both, I did not get to know my grandmother, Adja Fatim Menga, I did not get to know my grandfather, Badjie. So throughout our health inefficiencies, it's also a lot of lost human experiences. And I know every Gambian who's maybe 30 years and under has a Adja Fatim Menga story. Somebody who, by the time they realized that their health was in jeopardy, it was rather too late. So when we were starting Innovarx Global, we built the company around making sure somebody like Adja Fatim Menga can get access to the right medication at the same time. How do you do it? You pride yourself in sourcing quality medications that are fit for your loved ones and making sure they don't have to live in coma to receive that care. So for the past 3 years, we've had people in all regions of the Gambia that have not set foot into another pharmacy for 3 years, because every 28 days, we're able to deliver medications that they need for their chronic conditions like diabetes or hypertension, right? So the vertically integrated model that we have was designed to care for older persons in the Gambia. So even things like some of our older persons who have had our subscription care plans, where every single month they have a nurse that goes into the home to physically check on them. That is significant because now you are being very intentional about providing care for these older persons in a way that they may not receive that care month in and month out. So in our stories, we have some of our older persons who the best part of their month is waiting to see our motorcycle drivers roll up in Mansakonko, knowing that wellness is being delivered to them. People that if our staff is, on the way, the highlight of their day is having a nurse just check their blood pressure, because in that moment, they're receiving a little bit of intimacy, they're getting some care, they're getting conversation. So Innovarx has always focused on older persons, and I think now it's just transitioning where how could we even democratize that a little bit more to make sure it just doesn't include the people that can have access to us, but just start a conversation around how as a society can we repay our debts to the most valuable aspect of our society before it's too late.
And have you decided when to launch this joint initiative with ASI?
Yeah, so very exciting. We are gonna coincide it with May 1st, which is, I think it's very symbolic, being that we're celebrating workers around the world, especially in the Gambia, and this is a group of individuals that have worked for a very long time. Some of them are still working. I think when we celebrate even things like Workers' Day, we tend to consider only the traditional types of work, where being at an office in a government institution. But if you traverse around the country and still working for a very long time, so I think it will influence the program in May, but also with the initiatives past May. So we're excited about it. We hope that it influences or sparks a change across all industries, because once again, thank you for your service, something that should be embedded in our culture and at older persons in the Gambia as well too. But we're very excited about what's coming.